The title of this presentation is Childhood Apraxia of Speech by myself, Jamie Fuechenberger. What is childhood apraxia of speech, or CAS? Childhood apraxia of speech is a motor speech disorder that causes children to have trouble saying sounds, syllables, and words. A motor speech disorder means that the child knows what they want to say, but the brain has trouble planning to move the right part needed in order to make the sound, syllable, or word. Who does childhood apraxia of speech affect? Children of all ages. A young child may not babble, have late first words, a very limited sound inventory, and may have eating problems. An older child may make consistent sound errors, be hard to understand, be able to understand language better than actually speaking it, and have difficulty imitating speech. In order to be diagnosed with apraxia, a child would have to have a hearing test to rule out any hearing problems, and then the child will be evaluated by a speech-language pathologist. Research shows that children with apraxia benefit most from having frequent and intensive therapy. This is about 3 to 5 times a week. Children with CAS benefit more from one-on-one therapy rather than group therapy as well. Some possible causes of CAS include genetic disorders or syndromes and stroke or brain injury. Although these are possible causes, in most cases the cause is unknown. Incidence of CAS seems to be on the rise, but there is little data on it. A reason that it may be on the rise is because of the increased awareness of it. The data that is available suggests that 1 to 2 children out of 1,000 will be affected by childhood apraxia of speech. There is no cure for CAS, but with intensive therapy there can be significant improvement. If the child does not have therapy, there will not be any progression. Children with severe apraxia also have the option of using an AAC device in order to help them communicate. These are usually used for a shorter time period until there is progress made in therapy. It is not meant for long-term use for children with CAS. If you could ask one last question about childhood apraxia of speech, or CAS, what would you like to know?